So I'm gonna go ahead and sanitize my hands and introduce myself. My name is Miriam. I'm a nurse practitioner student. Today I'm going to conduct an exam, which is I'm going to do the head to draw assessment. This exam would need to change in position, standing, walking, and just in between, if you have any pain, you let me know. Please, can you tell me your name and date of birth and why you're here?
My name is Fred. I was born in June and I'm here for a medical checkup.
Okay, so the patient, do you have any pain?
No pain.
Patient is alert and oriented, is well groomed to this exam. He doesn't have any pain. I don't see any acute distress. I don't see any distress. So I'm ready to start the exam. Okay. So next I'm going to check the skin and I'm going to check your nails as well. Okay.
Okay.
I'm checking for the skin for any lesion and tenderness and swelling, which I don't see any. Okay, next I'm going to check your nails. I'm checking the capillary for the capillary refill. Good. The capillary refill is less than 3 seconds, which is a normal finding. I did not see any swelling, any lesions, and cracks on the skin. So next, I'm going to palpate and inspect the scalp, and the hair. Okay. I'm going to palpate for any tenderness, any ridges and mashes. Okay. Do you have any pain when I do this?
No, no pain.
Okay. Okay, so no pain on palpation, and the air is distributed evenly, which is a normal finding. So next I'm going to check the facial symmetry, which is cranial number 7. So I'm gonna, can you please frown for me and wrinkle your face, your forehead? Can you smile for me? Can you show me your teeth? Puff your cheeks? Puff your cheeks. All right. So the muscle strength is equilaterally. That means that cranial number 7 is intact. So next I'm going to check cranial number 5. Can you clench your teeth while I'm palpating your muscle? Okay. So cranial number 5 is intact. The muscle strength is equilateral. That means cranial number 5 is intact. So next I'm going to inspect the eyes from external. Okay, I'm going to look at the eyelashes, eyebrow, conjunctiva, the retina, the sclera. Okay, so I'm checking your eyebrows, checking your lashes, just relax. And next I'm going to open your eyes so that I can look at inside. Okay, so on the eyelid is symmetrical with no evidence of any with no evidence of any kind. The eyebrows are full and well distributed. The cornea is clear, no cloudy. The sclera is white with no signs of discharges, and so the conjunctiva is pink, no drainage, no discharge, which I don't not see any abnormalities. So next I'm going to assess cranial number 3, number 4, and number 6. I'm going to do the extraocular movement, okay? So I'm going to use my pen right instead of my finger. So I will have you follow this pen with your eyes only, okay?
Okay.
Okay, next I'm going to check the accommodation. I want you to focus on this pen as I bring it closer to your eyes, okay?
Okay.
There you go. So cranial number 3, number 4, and number 6 is intact because the patient was able to move the eyes and follow the direction. So next I'm going to check the pupil, which is cranial number 2, and cranial number 3. Okay, so what I'm going to do, I'm going to shine this flashlight in your eyes. So I'm going to check for the pupil size and the reaction to light. Okay,
Okay.
just focus on some. Okay, so sorry. Okay, so cranial number 2 and the 3 is intact. The pupil is equal, round, reactive to light, and accommodation. Okay, so next I'm going to do the eye exam. I'm going to look for the inner structure of the eyes, and I'm going to use the ophthalmoscope. Okay. Okay, perfect. So I'm gonna do on these eyes too. Okay, perfect. So I've checked I've done the eye exam. So the red reflex is equal, is present and symmetry. The retina is vessel are evenly distributed. The optic disc is less than 0.5, and the macula is darker, and the surrounding area of the retina is present. So next I'm going to check the external ears. So I'm going just to look at inside, outside of your ears.
Okay.
Going to. Do you have any pain and tenderness?
No pain.
Okay, I'm gonna do this side too. Okay. So and while I'm doing this, I'm going to test the gross hearing test. So I did the auricle side of the ears. The skin is intact. There's no lesion, no discharges. The canal, the auditory canal is clear without any discharges or any sermon and discharges. So next, I'm going to test the gross hearing, and I'm going to be behind the patient. So I'm going to close one of your ear, and I'm going to whisper. You tell me what I said, okay?
Okay. Apple.
Okay, I'm going to do the other one here.
Apple.
Okay. So the whisper test is intact. That means cranial number 8 is intact. Okay. So next I'm going to do the otoscope exam. Okay, so because it's an adult patient, so I'm going to, the technique I'm going to use, I'm going to put his ear up and back. Okay. Okay. I'm going to do this side. Okay, I'm going to use my hand. I'm going to pull back and up. Okay. So on this exam, the tympanic membrane is grazed. I don't see any swelling and discharges, any abnormalities. So there's no bulging, retraction, or perforation noted. So next I'm going to check the nasal cavity. I'm gonna use the other pen. I'm gonna use this one.
Okay.
So I'm going to look inside your nose. So the nasal septum is in the midline and intact. No signs of perforation noted. The tapinates are visible, and there is the nasal mucosa is pink and no drainage. So next I'm going to inspect the mouth and the throat using the tongue braids and the right. Okay, so I'm looking for any lesion, any redness, and white patches in the mouth. Okay.
Okay.
Please, can you open your mouth for me? Sorry. Before you say let me inspect first. Can you move your tongue up, side, side, and can you say Okay. So the buccal mucosa is pink. There's no lesion or any whitish, no noted. The soft and hard palates are intact and in the midline. So the uvula is in the midline when the patient said ha, which means the cranial number 9 and the cranial number 10 is intact. So next I'm going to check cranial number 8. Cranial number 7. So I'm going to tell the patient to, can you stick your tongue out and move side to side? Okay. So cranial number 8 is intact. The patient was able to move tongue side to side and is symmetrical. So next I'm going to do the inspect the neck and thyroid. Okay. So I'm inspecting the neck. I don't see any distension and jugular distension. So the midline, the trachea is in the midline, and the thyroid gland is not enlarged. So that's a normal finding. So next I'm going to palpate the lymph node. I'm going to be behind the patient.
Take this off.
Yeah, that's good. Okay, so I'm going to mention as I'm palpating the lymph nodes. So I'm going to start from submental, mandibular, the tonsil. Are you okay?
Yes.
Preauricular, postauricular, occipital, posterior cervical J, and anterior cervical J, and the supraclavicular. Okay, so I did not the lymph nodes are non-palpable, which is the normal finding. So next I'm going to what I'm going to do next one. So next I'm going to tell you.
Okay.
So I'm going to do next I'm going to do the range of motion in the neck.
Okay.
Okay, so Please, can you bend your neck forward, backward, sideways, and left and right. So the range of motion is equal, bilateral, and no pain noted. So next, I'm going to do the I'm going to check cranial number 11. Cranial number 11. I will let you, please. Can you shrug against my shoulder? Okay. And I'm going to. Can you turn your head against mine? Okay. So the strength, the muscle strength is equal bilateral, and that indicates that cranial number 11 is intact. So now next I'm going to palpate for the thyroid. So, okay. So I'm going to palpate. Tell me if I'm going harder. Can you pretend like you are swallowing? Okay. So no enlargement noted. That means it's a normal finding. So next I'm going to move. I'm going to auscultate for the lung sounds. I'm going to move some things from here. I'm going to start from the posterior chest wall. Can you face that way? Posterior facing down. Now you can sit down, but no, you can sit face that.
Oh, this way?
Yeah. So
Oh,
that
okay.
yeah. So.
So in frame.
Yeah, you don't have. And then I will say. Okay, so next I'm going to inspect. I'm inspecting for any abnormalities and skin lesion and
Oh, okay. I'm in frame. Okay. All right.
yeah, you're fine.
Okay.
Yeah, I'm just inspecting first, and then for any abnormalities and skin lesion and scars and deformity. So I don't see any. That's a normal finding. So next I'm going to percuss. So next thing I'm going to do, I'm going to auscultate for the lung sound. So I'm going to use the diaphragm to auscultate the lung sound. And please, when I put the stethoscope on your back, please can you breathe in and out for me? Okay. The all lung feel are clear to auscultation. So next I'm going to do I'm going to look at the interior chest. So I'm going to inspect first. I'm looking for any deformity and use of accessory muscles and scars, lesion, which I don't see any. So next I'm going to auscultate the lung sound, and I'm going to use the stethoscope as well. So the same thing, you're gonna breathe in and out as I put the.
Okay.
Okay. ferrants and I'll create bilateral rows, which is a normal finding. So next I'm going to assess for the shower pain, but I'm gonna let you lay down spine. Which side will you not lay down, that way or this way?
Yeah.
Okay.
Let's try it this way.
So I'm going to inspect for the internal and the external jowl vein.
Okay.
So I will let you like turn your neck that way. Okay. Should be. Okay. So I don't see any distension. That means the blood flow it flows no pressure when it's flowing. So next I'm going to next after this I'm going to palpate for the pulses, and I'm going to palpate for the carotid artery. Okay, so I'm going to palpate first for the carotid artery. Okay, so I'm going to palpate for the brachial pulse. Just relax. Good. And I'm going to do the brachial pulses too. Okay, I'm going to do the same. Okay. Both pulses are strong +2 and equal bilateral. So next I'm going to auscultate for the carotid artery. I'm gonna use the bell.
Okay.
Let me just. Okay. So I do not hear no bruits. So next I'm going to assess the pericardium. I'm going to be on this side.
Okay.
I'm just looking for any NFs or entries or any pulsation.
Okay.
Which I don't see any. So that's a normal finding. So next I'm going to auscultate 5 locations, and I'm going to name them as I auscultate. Okay. So I'm going to use the diaphragm, and then I will use the bell. Okay. Let's take a deep breath as I auscultate.
Okay.
This is the aortic. Pulmonary. The abs point. Tricuspid. The pulmonary area. So S1 and S2 is present to both. So next I'm going to use the bell to auscultate. I'm going to start from the aortic. Can you take a deep breath for me? There you go. Pulmonary, take a breath. Abs point. Take a deep breath one more time. Tricuspid. And the mitral area. So I did not hear any or I did not had any extra heart sound, any mama or troll or bruise or any bruise. So next I'm going to go to the abdomen. I'll let you just stay laying down.
Okay.
So I'm going to inspect and I'm going to inspect, palpate. No, I'm going to inspect, auscultate, percuss, and palpate. Okay. So first I'm looking at the abdomen for symmetry, for any movement and accessory muscles, tenderness, lesion, or that. Okay. So I don't see any of that, which is a normal finding. So next I'm going to auscultate for the bowel sounds. From the lower right quadrant. Upper right quadrant. So the power sounds are present to both quadrants. Next, I'm going to auscultate for the aortic, iliac, renal, and then the femoral artery. Okay. So the aortic is just close to the umbilicus. So I'm going to auscultate here. Okay, so I'm going to auscultate for the renal, both sides. I'm going to auscultate the iliac, both sides, and femoral. Down here, just should be down here. So I did not feel any bruise, which is a normal finding. So next I'm going to percuss. I'm going to start from here. I'm percussing for any tympani or recession. So that sound is dull, which is a normal finding. So next I'm going to palpate. I'm going to start with the right touch and then I'll go to the deeper touch. But if you feel any discomfort, let me know, okay?
Okay.
So I'm palpating for any mashes and tenderness. Okay, so I'm gonna go to a deeper touch. You okay? Yeah. Okay, I did not feel any masses, and I did not feel any masses or no tenderness or no lesion. So next I'm going to palpate the liver and the spleen. So I'm going to palpate the spleen from the right side. I'm going to put my arm this way just to support. Or I would just let me palpate the liver, the spleen first. Okay. Want you to take a deep breath. Take a deep breath. Okay, it's non-palpable. I did not feel it. So next I'm going to palpate the liver. I'm going to do the same thing. I'm going to put my arms here. I want you to take a deep breath. Oh. Okay. Both side for the liver and the spleen is non-palpable. So next I'm going to jump ahead and I'm going to if you can sit up for me. So I'm going to inspect for the lower extremity, and I'm going to do range of motion, palpating, and all that. I will tell you as I go through. Okay.
Okay.
So
For the.
All right, you can lay down. Let me see if this works. I'm gonna move the camera a little closer. Okay, so I'm going to inspect the lower extremities, and I'm going to palpate. I'm gonna take this out. I'm going to inspect for any lesion and masses and swelling, and then I'm going to palpate for the pulses. Okay. So I'm looking for any masses and lesion and tenderness. I'm going to palpate the calf. Do you have any pain?
No pain.
Any pain?
No.
Okay. Do you have any pain down?
No.
Okay. And so next I'm going to palpate for the pulses. I'm going to do the dosaris pedis. I'm going to palpate for the pulses. Pararo. Pulses are too strong and bilateral. Next, what I'm going to do a range of I'm going to do range of motion, and then I will check this the strength at the same time. So I'm going to start from the hip. So the hip, we are doing flexion, extension, adduction, abduction, and internal and external rotation. So we're going to start with flexion. So extension would be like when you're laying flat, you extend your knee back. Can you do that? No.
Go back like this?
Yeah. You extend your hip and the lateral leg. Extend. Okay. So we're going to do the adduction. No, we're going to do abduction. Adduction. Abduction. Adduction. We're going to do internal and external rotation. External and internal rotation. So we are done from the knee. Now next we are going to the hip. We are done from the hip. Next we are going to the knee. So the knee is flex and flex. On a flex and extension. I think that's all for the knees. Next we are going to the ankles. For the ankles, we are going dorsiflexion and plantarflexion. Can you do this? Okay. So next I'm going to check strength on both So I'm gonna start from the ankle. Please, can you push against my? Don't let me push you. Okay, that's for the ankle. Can you flex your knees? I'm gonna pull you. Don't let me pull you. Okay. Next, I'm going to do the strength on the hip. Don't let me. Okay. Hip. Don't let me put up. All right. So next we are going to do the upper extremity. Yeah, you can see it. I mean the lower extremity. I mean the upper. It's the lower extremity, right? So we are done from the lower extremity. Now we are going to do the upper extremity. We are starting from the shoulder, the elbow, the wrist, and the fingers. First, I'm going to inspect. I'm looking for any lesion, any swelling, any deformities. Okay. So I don't see any swelling, I don't see any deformity, I don't see any lesions. So next we're gonna go chamber head and start the range of motion. We're gonna start from the shoulder. So the shoulder, we're gonna do both hands. We're gonna do flexion, extension, flexion back.
Okay.
So we're gonna do adduction,
Okay.
or abduction, adduction.
Okay.
Next, we are going to do like you are combing your hair, put hair, and then like you're putting on your shoulder. That's internal and external rotation.
Okay.
Okay. So next, we are going to do the range of motion on the elbow. So it's stand, right, and do spanation, pronation, spanation, pronation. So next we are going to do on the wrist. Okay, so this is gonna go stand, side, side. Okay. Next we are going to the finger. So the finger we are going to. Oh, and did I say the pronation and spanation?
Yeah,
Okay.
right.
So the finger we are going to do adduction, abduction. Close your finger and open your fingers. And okay. Next we are going to test for the strength of the finger. Can you close your finger and don't let me open? Okay. Next we are going to test the strength on the wrist. Don't let me. Okay, next I'm going to test for the elbow. And both. Don't let me bend it. Okay. Next I'm going to shoulder. I don't know, shoulder. Okay. So the next thing we are going. I think I'm done with the shoulder. So next I'm going to. So yeah, or the tricep.
Oh.
Okay. 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 So next I'm going to do the next we are done from this. So next I'm going to tie it down. So next I'm going to do, I've done the strength on the upper extremity. So next I'm going to check for the reflexes. Okay. So I'm going to start from the upper extremity and then I do the lower extremity. So the upper extremity, I'm going to test the reflex. I'm going to start from radio. Just relax here. There you go. So next I'm going to do the bicep reflex. Just gonna relax. I'm gonna hold it. Relax your arm. Okay. That's good. Next I'm going to do the tricep. So I would like you to put your arm this way and be like you are that way. Just relax. There you go. And I'm gonna do the same on both hands. Relax. Okay. Next. Bicep. Bicep. Tricep. So next I'm going to check the patella. I'm gonna move the camera back. So I'm going to check the patella difference. Just relax. Okay, there you go. Now I'm gonna do on this leg. Just relax. There you go. So next I'm going to do the Achilles. The Achilles, can you lay down?
Okay.
I don't know. So the camera, my camera cannot see all the way down. So the way I could have done it, I'm gonna just hold the patient like this and then do from this side. Okay, and that's the Achilles tendon. I mean reflexes, and they are both intact. No chronus or no reflex activity. No chronus or abnormal reflexes activity noted. So next, I'm going to do the sensory. I want you to follow. I would like you to follow my touch your finger, touch your nose, and touch my finger. Okay, so the coordination is intact. So next I'm going to use the dull and the soft touch. I'll let the patient close your eyes. You tell me if it's dull or it's sharp, okay?
Okay.
Close your eyes.
Down. 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 Down.
Close your eyes still.
Sharp. 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 Sharp.
Okay. So next I'm going to let you have you stand.
Okay.
I'm going to check for your I'm going to palpate your spinal and I'm going to do the range of motion, okay?
Okay.
Can you bend forward for me? I'm going to palpate. So the spinal is on the midline. I don't see any curvature or any deformity. So next I'm going to have you do the spinal range of motion. Can you bend sideways, backward, forward, side to side? Okay, so next we are going to walk the heel and the heel to toe walk.
Okay.
Oh, I don't know if, okay, you stop. All right, that was intact. So thank you for your time, and I appreciate you for your time. Thank you for your time and appreciate. I'll see you next time.
All right,
Okay.
thank you.
You're welcome.